Hi, Mr. Williams. I'm Tara. I'm going to be your nurse practitioner today. How are you doing?
Good.
Good. Okay. And what brings you in today?
I'm here for my assessment.
Okay, that's right. We're going to be doing assessment. Today's assessment includes me checking your chest, your lungs, your heart, and your peripheral vascular system. Is that okay with you?
Yeah.
All right.
Good.
To get started, I'm just going to get some background information from you, a little bit about you. Do you have any cough or shortness of breath?
Mm-mm.
How about any asthma or breathing problems? Any chest pain or high blood pressure? Any problems with your heart at all?
Nope.
Okay. So to get started, I'm going to do an inspection of your chest and your back. And what that entails me is I'm going to look you over, and then I'm going to also be pressing on you just to be checking for any tenderness or any pain. Then I'm also going to listen with my stethoscope to your heart and lung sounds. Okay. So to get okay, now to get started, I'm going to inspect the chest. I'm just going to take a look at your chest and make sure everything is symmetrical and even. And what I'm looking for is to make sure there's no deformities. Um, your spine appears straight, no curvatures in the spine. Shoulders look even and symmetrical. Everything looks normal. Um, Now I'm going to check your AP diameter, and that's the anterior, posterior diameter to your lateral diameter should be about half, which it is. So that's normal, and that's just making sure you don't have any like barrel chest or anything like that. Next thing I'm going to do is just look at your breathing. I'm just going to watch the rise and fall of your chest. And I'm going to see how fast you're breathing. So I'm going to time your breathing. So you just take deep breathe normal. And I'm going to see how many breaths per minute you're breathing. Okay, your respiratory rate was 18. Your breathing was even and unlabored. No signs of symptoms of distress noted. There was no use of accessory muscles noted. The next thing I'm going to do is check for thoracic expansion. So I'm going to have you turn your back and let's face the camera. That's good. So I'm going to put my hands on your lower back, and then I'm going to have you take a big deep breath in and then exhale. Okay, and do it again. And one more time. Good. That was normal. Okay, you can turn back around and face the camera. Now I'm gonna palpate. When I palpate, I'm just gonna palpate across your chest, and I'm gonna be assessing for any tenderness, seeing if I feel any masses or bulges. So I'll do that, and you let me know if you feel any tenderness anywhere I push. No tenderness, no masses, no bulges, and I don't hear any crepitus. And that what crepitus is air in your up under your skin. So that's good. You don't have any of that. Now I'm going to check for what we call it's called tactile fermentation. So I'm going to have you turn facing the camera, your back towards the camera again. And then I'm going to have you repeat the words 99. So whenever I touch you, I'll have you say 99. Ready? Go.
99, 99, 99, 99.
Okay. Tactile fermentation is intact. Okay, so now I have you facing this way, I'm going to do some percussion, and that's going to tell me just tapping on your back and listening to the sound I get. Okay, and I'm going to start on the side, and I hear resonance. Okay, and now I'm going to measure for diaphragmatic excursion. So with that, what I'm going to have you do is take a deep breath in and have you hold it. And while you hold that air in, I'm going to do the percussion tapping on your back. And then I'm going to mark the spot where it goes from resonance to dullness. So once I tell you to take that deep breath in, I want you to take a deep breath in and hold it. And then I'll start the tapping on your back. Okay, take a deep breath in and hold it. Okay, let it out. It's about there. Okay. Now, the next thing I'm having you do is when you take that deep breath in, actually, I'm going to do it on the other side first. So take a deep breath in and hold it. Okay, let it out. For the next thing I'm having you do is take a deep breath in, and when you exhale, I want you to hold it. Ready? And go. And let that out, and then hold that air out. Now breathe. And big deep breath and exhale and hold it. Okay. So that was about from here to here. So I'm going to take my tape measure and measure the diaphragmatic excursion. Yours is 6 and normal is 3 to 5. So that is a good. Okay, for this next part, I'm just going to assess your trachea. So I'm going to have you tilt your head up a little bit. And I'm just going to put my fingers here at find your suprasternal notch, which is right there. And then I'm going to feel for your trachea. Okay, there it is. And it feels mid-position, even on both sides. And then suprasternal notch is right under that. And I'm going to go down, palpate down. And sorry, I'm going to push a little hard. And there is your angle of Lewis. Now, the next thing I'm going to do is use my stethoscope to auscultate to listen to your lung sounds, okay? When I listen to your lung sounds, I just want you to breathe normally. So once I place the stethoscope on you, I want you to just take those nice deep breaths in and out, and then every time I move your stethoscope, take a deep breath. And I'm going to listen with my diaphragm. I'm going to listen right at find your clavicle. I'm going to listen at the apex of your lungs. So take that deep breath for me. Get that out. On the opposite side. Deeper. Another deep breath. Good. Now I'm going to have you turn around to your back. I want to listen to your lungs from the back side. Okay, so this part I'm going to listen to your lungs posteriorly. And I just want you to take those deep breaths every time I put my stethoscope on you. And I'm using my diaphragm, so deep breath. Good. Another one. Good. Deep breath. Good. Another one. Good. Deep breath. Sounds are clear. No adventitious breath sounds heard. Hold your arms up for me. I'm going to listen to the sides. Deep breath. Deep breath. Good. On this side. Good. No adventitious breath sounds heard. You can put your arms down now. And while I have my stethoscope, I'm going to do have you say 99 again. I'm going to use my stethoscope to listen to the vibrations.
Okay.
So every time I place my stethoscope, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and that sounds normal. So I was able to hear a muffled 99 up here. Then as I went downward, it started to get more muffled and hard to hear. Okay, for this next part of the assessment, I'm going to be assessing your heart and peripheral vascular system. All right, that's going to start with me inspecting your body. I'm just going to be looking over your body, looking at your color, making sure there's no skin discolorations. Also going to look at your chest, make sure there's no skin discolorations. Looking at your arms, your legs, skin looks normal color. Going to check your temperature on your arms, your hands. Everything seems warm. Legs are cooler to touch. Going to look at your fingers, checking your capillary refill. It's less than 3 seconds. Also going to check your capillary refill in your feet. And that is also less than 3 seconds. And you have hair on your toes, which means you have good hair distribution. Okay. And next, I'm going to palpate. I'm going to just be putting my hand on your chest. I'm going to be feeling for any what we call heaves or lifts. I'm going to put my hand right here over the apex of the heart. You're going to take a deep breath. Hold it. Good. And I'm also going to put my hand here. Breathe hard, deep breath again. No heaves or pulls felt. I didn't feel any thrills. Okay. And now I'm just gonna check your pulses. So you have a carotid pulse. I want you to tilt your head back just a little bit. I'm actually gonna see if I can visualize that before touching it. Yeah, and I actually see yours right here. I'm gonna palpate now. Okay, no thrills felt. Now I'm gonna check your brachial pulse. Then I'm gonna check your radial pulse. And then I'm gonna check your popliteal pulse. And that's at the bend of your knee. Okay, that feels normal. I'm gonna check your posterior tibialis pulse. I can feel that one. That's normal as well. I'm gonna check your pedal pulse. Good. Now I'm gonna just check on the other side. Your popliteal pulse. Go under your leg. You can relax your leg for me. Yep, I feel that one. Posterior tibial pulse, and then your pedal pulse. Good. Good feel both of those. Now I'm gonna check your femoral pulse, and that's usually in the groin area. Check your radial pulse. That one feels normal. Check your brachial as well. Okay, all your pulses feel normal. Now I'm going to listen to your heart sounds.
Okay.
Okay. So I'm going to listen to your heart sounds in 5 locations. The first location is going to be on the aortic heart sound. To find that, it's going to be in the second intercostal space on the right. So tilt your head up for me. I'm going to find your angle of Lewis, which is in the middle, and that's right about at the second intercostal space, and that's where I'm going to listen at on the right, the second intercostal space for that heart sound. S1 and S2 sounds are heard. Now I'm going to go directly across on the left to the second intercostal space, and this is the pulmonic sound. S1 and S2 is heard. I'm going to go down to the third intercostal space. This is Erb's point. And this is the space where we would listen for an extra heart sound like S3 or S4. I don't hear any. Then I'm going to go down to the fourth intercostal space, which is the tricuspid heart sound. And this is where the S1 sound is heard the loudest. Then I'm going to go over to the mitral valve space. This is in the fifth intercostal space on the left side. And this is also where the point of maximal impulse is felt. So that's the apex of the heart. So I'm going to have you turn. I'm going to put my heart stethoscope back on the fifth intercostal space. And I want to listen to your apical heart rate. If you just turn to the left side for me, that'll give me a better. Go ahead and turn.
On my side.
Okay, yeah, I can hear it better. Okay, you can turn back over for me. Okay, now I'm going to listen to those 5 locations again, but this time I'm going to listen with my bell, and I'm going to be checking for any heart murmurs. I'm going to start on that second intercostal space on the right side. And this is the aortic heart sound. And I'm going to go to the left intercostal space. Second intercostal space on the right side, the pulmonic heart sound. Erb's point. Fourth intercostal space is the mitral valve, or tricuspid valve, I'm sorry. And then the fifth intercostal space. I did not hear any murmurs. So now I'm going to listen to your carotid while I have you have my stethoscope out. So tilt your head back for a little bit. And here I'm checking for any thrills or any bruits. And everything sounds normal. Now I'm going to check what we call a Homan sign. I am going to flex your foot up, and I want you to tell me if you have any pain in the back of your calf. I'm going to lift your leg up and hold it. Then I'm going to flex your foot. Do you have any pain in your calf?
No.
Okay, perfect. That's negative. And for when we do that, we're checking to make sure you don't have any blood clots, and yours was negative. All right, so now that concludes our assessment. Do you have any questions?
No.
Thank you.